Hey everybody, it's Kelly again. I wanted to talk to you guys a little bit about psychiatric mental health nursing and what it entails, as that is my specialty. I've been working in the field for 6 years and wanted to give you guys a little overview of the different arenas that psychiatric mental health nurses can work in and the types of patients that we take care of. So, as I said, it's a specialty within nursing, promoting mental wellness and providing compassionate care to individuals dealing with mood disorders, psychiatric disorders, often a wide range of other mental health conditions, trauma-related issues, substance abuse disorders, and the role of a psychiatric nurse really hones in on being able to blend their medical knowledge and training with therapeutic communication. And we're seeing these patients on the worst days of their lives, and we're trying to make them feel better. And it's challenging at times, but it's essential to keep an open mind when dealing with these individuals. They are a very vulnerable population of people, so it takes a really special subset of skills to hone in on the needs of these patients. And psychiatric mental health nursing does that. There are some nurses who choose to just specialize in substance abuse disorders. And a lot of times you'll find these nurses working in detoxification units. They will be working in like clinics to help give their patients their medication-assisted treatment for prevention of relapse. A lot of times we're in inpatient psychiatric hospitals where I currently work. We address their addiction and detox them from the substance. And we also then address their mental health and well-being, because more often than not, a substance abuse disorder is co-occurring with another mental health disorder. A lot of times we'll be in outpatient clinics, some private practices. Psychiatric mental health nurses also work in correctional facilities, emergency departments, and there's telehealth available as well. A lot of times psychiatric mental health nurses go on to further their education and become psychiatric nurse practitioners, which is there is a huge demand for that right now. And there's a huge demand in this population for nurses willing to work in this specialty. Also available is for RNs who don't want to get an advanced degree, they can become certified as a psychiatric mental health registered nurse. That is also an option, and one I'm currently pursuing. Within this population, we deal with all ages and ranges: children, adolescents, adults, and the geriatric population. A lot of times they have dual diagnoses with, substance abuse and depression, all kinds of things. And as they get older, other comorbid medical conditions can play a part and sometimes exacerbate mental health issues. This is where, as a nurse, our medical knowledge and training comes into play. Another role that psychiatric nurses have is to try to minimize the stigma surrounding mental health and substance abuse. As a whole in this country, we have done a lot better in the last 5 years or so, bringing more light to mental health and well-being and substance abuse. People are more willing to talk about it, seek treatment for it. And as a result, the need for nurses to work in this specialty is ever growing and is in high demand. So if that's something that you're interested in, let me know. I can maybe give you some pointers and tips on how to start, getting your foot in the door in this field. And if you have any other questions regarding what I do as a psychiatric nurse, or what any of my coworkers do, the type of patients we treat and see, drop a question in the comments and I will get to them and answer them as best I can. And I will talk to you all soon. Bye.